We're talking to Mayor Jeff Williams from Arlington to answer all of our questions about the spread of the coronavirus and what's being done as a community to move forward. Good morning, Mayor Jeff Williams. How are you?
Doing great. How are you?
Now, Mayor Williams, Dallas has just ordered a shelter-in-place restriction. You had implemented restrictions in Arlington before the governor implemented his. And it's no secret we're in uncharted waters right now. What has navigating through this pandemic been like for you, I guess, both on a professional and personal level?
It's been very difficult decisions, and having to really research and be with the medical professionals who have devoted their careers to infectious diseases. And so, but then when you make decisions to close businesses, that is so hard.
Mayor Williams, since you're having a direct conversation with medical professionals and making these decisions, is there a timeline that you know about that some of these businesses might be able to open their doors back up again and we can get through and flatten the curve?
Brett, there's not. And that is probably the most frustrating thing for all of us, is that no one knows the timeline because this virus is new. They're studying what is going on in Europe and China, Korea, Singapore to try to see what's best. Now, I will say the plus is that all of the medical professionals are together in telling us to take care of our personal hygiene, to stay healthy, social distancing, stay away from crowds so that this doesn't spread. That is all a consistent message from both our local medical professionals, state and federal levels.
Mayor Williams, for a lot of people, I think even me, I worry sometimes that even if I start showing symptoms or anyone starts showing symptoms, they think twice about getting tested because, one, going outside would put other people at risk who are most at risk, like the 60-plus community. And two, there just aren't enough tests. What advice would you give to people like that, or what would you say to those people? What should they do?
That is such a good question. What they need to do is to call their physician, and their physician will give them instructions, because we don't need people running to the emergency room or even going to the doctor's office unannounced. But they can prepare for you and tell you where to go so that if you did have the coronavirus, they would be prepared and you wouldn't be spreading it.
So, Mayor Williams, we saw that the Dallas County has made a shelter-in-place decision. What is going to be the decision in Tarrant County moving forward? We know that Governor Greg Abbott has been very hesitant to make the decision as a statewide. What is your game plan moving forward for Arlington?
I met with Governor Abbott. He came to Arlington a couple of days ago. A lot of states are following the CDC guidelines like we are, and I think it's great that this is across our state now. So if we can cooperate and do the things that we're being instructed to do, we have a great chance to avoid a lockdown, and that's what I'm hoping for.
Mayor, can you take me through the game plan for schools? I know there's a lot of parents out there that listen to us every single day, and right now we're closing down schools until early April. Could we see it going longer? And if it does end up going longer, what will be the game plan in terms of graduation or makeup testing?
Well, really, all I can say is that the governor has said he was going to be reviewing that every couple of weeks.
Okay.
And of course, that's at a minimum. With the way this has been going, there have been, reviews. For us, it's every day. And I think and the governor has been on this night and day himself. You asked a question that I don't know. That would be a great thing to ask later. Right now, I don't think anybody knows. There is light at the end of the tunnel. Look at what is being done in South Korea and Singapore. They have had success. So, and we're doing the things that they did to be successful. So there is hope. It's just we don't know the timeline. And a lot of the timeline is dependent upon us. If we will, one, break some of our old habits of shaking hands, and we need to not be touching our faces and so forth, and then cover when we cough, and then instead of trying to power through when you're sick, you need to stay at home, and then we've got to work hard on our social distancing. And that's a hard thing for many of us. We're huggers.
Right. I know I am. Yes.
Yeah, we can't be doing that.
A lot of love in Texas.
I promise.
Mayor, I know you're busy, but one of the other questions I had too is like, because of the big change in lifestyle, like a lot of kids being home, going back to the schools, do you have any advice for parents who have to go to work and now have been all of a sudden have to put their kids in daycares or childcare or find any kind of type of resources for them? Is there any type of advice, because that can be expensive and the space is limited for them?
Well, childcare is being worked on to provide some other alternatives right now. And that's, I know here countywide, here in Tarrant is, I know Dallas is too. So stay tuned. There'll be more alternatives, but we've got to continue to try to be productive in our businesses so that we can have jobs, so we can put groceries on the table. Something I want to be sure and push out is we have seen great kindness and generosity by our citizens who have been helping to deliver groceries, to run errands for our at-risk population, that is that group over 60 years old that may be having respiratory or heart disease. So to try to keep them to stay in their homes. Our churches have come out, our mosques, our synagogues. We need to be sure and try to help each other, because some are going to be hit harder than others.
Absolutely.
Well said,
it takes
Mayor.
a village. And we just want to thank you so much for being with us, answering our questions, and leading us during this difficult time.
Thank you.